The 20th of May is the World Metrology Day. It celebrates the signature of the Meter Convention, which establishes the framework for a global collaboration in measurement science and its applications. This year, under the theme of Measurement for Health, it is intended to highlight the healthcare in times of pandemic, and the importance of the measurements in this domain, as well as in the scope of storage and transport of vaccines. In a healthcare environment, any deviations in the value of the monitored parameters may imply an incorrect diagnosis, and the application of an inappropriate therapy. In addition to the identification of these deviations, the calibration and verification of the equipment ensures that they have metrological specifications suitable for their use, namely the most used measuring instruments in hospital facilities, such as perfusion pumps, scales, thermometers, sphygmomanometers, and dose monitors in the field of ionizing radiation. In the technical field of temperature, the control of this parameter is currently very relevant for the logistics associated with the transport and storage of vaccines. Most health services have technical and maintenance facilities to ensure the technical and metrological conformity of the medical devices with measuring function. This is very important to ensure their proper performance. For example, the verification of infusion pumps is carried out through a procedure widely applied and supported by a Guide of Good Practices, published by the Portuguese Sectorial Commission for Health. Another relevant example is the verification of tympanic thermometers and blood pressure devices, whose guides to good metrological practices are a reference support for the implementation and consolidation of these approaches. The verification of the conformity of several sensors incorporated in infant incubators are also examples, namely for air temperature, relative humidity, and carbon dioxide sensors. The metrological verification of these multi-parametric monitors is carried out using simulators. The metrological traceability of medical devices is an essential requirement to assure the accuracy of its measurements. IPQ, as a national metrology institute, together with the designated institutes, whose activity is developed in the field of scientific, applied, and legal metrology, has the mission of realizing and maintaining the national standards of units, and ensuring their metrological traceability to the international system of units. The use of primary methods and national standards guarantees directly, or indirectly, the traceability of measuring instruments, used in diagnostics and treatment. The realization of these activities and the implementation of new techniques is only possible due to the worldwide collaboration and the capabilities and synergies established by IPQ, which are essential to guarantee the traceability of the measurements and contribute to protect and improve the health of all.